And now, it's time for the Stain Game with your host, the one and only Justin Menezes.
Hey, welcome everybody to the Stain Game podcast. My name is Justin Menezes. I'm your host, and today I am joined by my lovely wife, Athena Menezes. Athena, how about you introduce yourself?
Hi, I'm Athena. I'm a physical therapist. I graduated from University of Nebraska Medical Center in 2023. And my husband was super supportive of me because, we have 6 kids. So becoming a physical therapist requires a bachelor's degree and then a 3-year doctorate degree on top of that. And so while I was in grad school, he managed the house. So I really appreciate that. While I was in school, I also took extra classes for pelvic floor physical therapy, and I am certified pelvic floor physical therapist as well. I just began my business Tele-PT a couple of weeks ago, so I am new to the entrepreneur world, but loving it. So,
well, welcome to the small business world, and where stress never ends, it just begins. So some of you are probably wondering, what is a physical therapy? That's the title of today's program, is Physical Therapy for Stainers. If you're a painter, it applies to you. If you're a fence builder, deck builder, anybody dealing with the staining, deck building, fence building, construction world, you're probably wondering why physical therapy. Well, you're about to find out why physical therapy is important to have as a tool in your toolbox. I personally, I'll start off with a little story. In 2009, give or take, I injured my back pretty severely to where I was working at the post office and doing the Army National Guard. I was at officer candidate school, and we were doing our final PT test before we headed off to a 2-week course. And it was probably the hardest 2 weeks before I could be commissioned. And as I was doing my PT test to qualify to go off to this 2-week program, I was doing the sit-up portion, and I was rocking it out. And we always want to do the very best, not the bare minimum. And I remember going up and feeling like a tear, like somebody had stabbed me in the back. And I went back down to the start position, and all of a sudden I couldn't feel anything in my back but pain. And I remember the cadre screaming, cussing me out, calling me a lazy ass, calling me this and that, other words I won't repeat, and I apologize for saying ass if that offends you. But just chewing me out, like, how could you be giving up, and how can you be, you're so close. And tears were streaming down my eyes, and I looked up at him, and he was Sergeant First Class Armstrong. And I said, "Sergeant, my back is messed up." And he kicked me in the hip, and he said, "Get up, Menezes. You can't quit." And I just let go of the stance, the sit-up stance with the hands behind your head. And I just said, "I can't move." And so he then realized there was something serious happening. So anyway, from that point, I went home, was hoping that my back would heal with some rest. Next morning, tried to get up to go to work. And I remember driving in a Honda Civic that we've talked about before, that we used, driving to work and being in so much pain, having to pull over and call into work and telling them that I can't come into work. But that led to still being in pain, eventually going to a back specialist, and then a back specialist telling me that I would need to have 2 rods surgically implanted and my lower lumbars fused. And after some thought and prayer, we decided that we weren't going to do that, and that we were going to try chiropractic care, and we did some physical therapy. But long story short, we do get hurt. And in the staining business, and the fence building business, the deck building business, there are times where we hear our backs or hear our bodies telling us we need to slow down, we need to stop. and we have a tendency of trying to get work done and pushing through. And a lot of times that leads into further damage or greater damage instead of stopping, listening, and adjusting. And so I thought it would be a great idea for my wife, who I'm blessed to have, who's a physical therapist, to come on here and talk about the benefits of physical therapy. So Athena, why don't you lead in and give us kind of a breakdown. What are the benefits of physical therapy?
So one really interesting thing that I've been learning about is how trauma can affect our bodies. If you've experienced abuse in the past, psychological, physical abuse, a lot of times our brains will, as a coping mechanism, decide to turn off our sensation to our body in a protective way. And so we grow up and we kind of learn to tough things out and not listen to our bodies. And what ends up happening is when we do that, sometimes we can injure our bodies. So one of the things that I've been trying to mentor Justin with is to listen to his body better. I'll just ask him some questions like, how are you feeling today? Or how is that, pain you had before? Like, how is that going? And so you want to talk a little bit about how that's been developing?
Yeah. So I'll just put up this little picture. You probably can't see it.
There we go.
Anyways, you can't see it.
Put it right here. Put it right here. Oh,
you still can't see it. It's all right. I'll take a picture of it and post it with the video. There's at least for me, I'll speak for myself. I will not speak for everybody else. So for myself, I have a tendency of pushing through and feeling like we need to get the job done. There's no time to stop or take a break. And that's just who I am. And my wife knows that. I am a workaholic. I love to work. I feel a lot of satisfaction when I am working. And kind of a side funny story, there's been times where I was working for somebody else and I was just happy to have a job. And I didn't even know how much I was earning. I just was grateful to come home. Oh, there we go. So I was going to use this picture afterwards, but this is kind of how we all feel, right? We're big, we're strong, we're the males, we provide. And so there's a lot of times for me personally where, so I've been dealing with back pain for about the last week or so. My physical therapist, who diagnoses me with different tests that she runs, says that I have a muscle sprain.
Yeah, grade 2 muscle strain.
Strain.
Yep. Muscles are the quickest tissue that will heal. So I love that. They take 2 to 3 weeks. Ligaments are slower. They take about 6 to 8 weeks. And bones are the slowest. No, nerve tissue is actually the very slowest. But
yeah, and so as all of you know, there's a lot of twisting and a lot of turning, a lot of repetition in what we do. And there's a lot of times where so for me, if I'm carrying stain, like we were staining a few fences last week, and you're carrying 5 to 6 buckets of stain into a yard, trying to take 2 buckets and making sure you're leveled out instead of 1 bucket in one hand and a brush in the other. So now you're compensating or leaning towards the other side. So those motions were continuously hurting the strain that was happening in my back. And I was telling Athena this morning on a walk when we were walking together that she put some kinetic tape on my back. And what is beneficial about that kinetic tape is that if I'm twisting or turning in a direction that stretches that tape out, it begins to kind of pinch or pull on your skin. And it kind of gives you that, oh, that hurts. Maybe you don't want to keep doing that. And then she was telling me that the kinetic tape is kind of, I'm probably screwing this up.
No, you're not. You're just putting
it's basically telling your body that that's hurting, so you stop, and your brain is not relying on the actual pain to then trigger and say, oh, something's wrong. So yeah, there's a lot of things that we do that we should be for the betterment of ourselves and for the long run of our health, be able to acknowledge that something's not right. It's time to take a break or to lessen the weight that we're doing or the movements that we're making and adjust.
Perfect, Justin. So that leads really well into the motions that are typical for painters and stainers. I've seen a few of these things, like the twisting. He brushes, the stain onto the floor of the deck. And Justin also talked a lot about kind of overhead brushing. And so one of the things that I've been suggesting to Justin is that he becomes ambidextrous.
Now, what is ambidextrous?
Ambidextrous.
Oh, well, I am not going to repeat it twice. The amber. What is the
ambidextrous? Anyway, ambidextrous just means that you're switching hands. Like if you're predominantly working that right, then maybe start training your left. Even though it's slower at first, your brain will learn, pick it up, and you'll be able to work with both arms, both shoulders. Your body will benefit from that resting time that you're giving to the dominant side. And another really kind of important, this is important. So stainers, painters, a lot of you're doing a lot of reps, right? A lot of motion in the same angles, same way, and not a lot of load. So what happens with those, a lot of reps, not a lot of load, is that you're kind of wearing out the place where your muscles attach to your bone or the tendon. So you can have a little bit of, it used to be called tendonitis. Now we call it tendinopathy. And a way to recover from that or avoid it, that's what we're really out. This podcast is really about avoiding injury, right? If you want to avoid injury in those tendons, it's really quite simple. You do the opposite in a workout. Instead of high reps, low load, you do a few reps with a higher load, something that you can manage. I mean, I'm not asking you to max out or anything like that. Always start your workouts where you're comfortable and gradually build your strength. But that's going to benefit your tendons.
See, and I've been doing it all wrong. So I've been exercising for the last couple of years of doing high reps and manageable weight. And when you said that, I kind of laughed and kind of shook my head because I was talking to my best friend, Dan Robinson. Dan, if you're listening, sorry, I've been giving you all the bad advice. You have been doing things right, because he's a heavy lifter. Sometimes he lifts too heavy, but so what you're saying is lift heavier, lower repetition, because you're not trying to, you're not breaking the rust off of that squeaky hinge. You're just trying to strengthen that hinge instead of putting a lot of reps on it.
I really like that analogy of the hinge.
I got some good analogies every once in a while.
What happens if you have hypertrophy? So let's say, I don't know, it's hard to see with my hands, but imagine a muscle belly. Just like this little,
like a dad bod.
I'll
show you my belly. There we go. I'm not embarrassed. See, a dad belly.
Oh,
there we go.
Okay. So, and its attachment to the bones is stronger when you actually increase or have some hypertrophy in that muscle. The tendon at either end of the muscle also gets very strong, and that's what we want.
Yeah. So if you don't think that's applicable to us, think again, guys and gals, right? If you're a fence builder, Chris Hearn, for one, who likes to listen to this, and I appreciate him following and listening. He's a guy who has a dad bod. He's a very strong, tall, burly man. And Chris, you're probably not out there doing the repetitions with your arms when it comes to brushing. But when you think about how many boards that you are lifting when you're building fences and carrying, and then probably the motion of the nail gun, right? You're ta, 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 ta. So there's different things that we do that the repetition takes place, and then we're straining those muscles or those joints and those bones. So for fence builders, there's a lot of lifting and carrying. You're probably carrying on your stronger, more dominant side compared to switching over. And then you've also, when you're nailing with those air guns, those fence boards, you probably hold it in your dominant hand and you don't switch off when that hand gets tired or achy. So yeah, it's applicable to many of us in this industry.
So 3 things that we've spoken of are listening to our bodies better. Okay, that actually right there will really, believe it or not, improve your odds, okay, or decrease your chances of having a painful injury. Okay, listening to your body. Second, we've talked about becoming ambidextrous. Try it again. You can do it. Say it, baby.
Amber. And no, there's not a missing child.
And the third thing we talked about is when you're having a lot of reps with low load, you want to prep those muscles with a lower rep and higher load, kind of the opposite. But you could do that at work too. It doesn't mean you have to do that at the gym. So just be creative. So those 3 points, I think, are our take-home points.
Awesome. So let's talk about, I'm just trying to think what I wanted to ask you. We have some notes, so if I'm looking down, that's what we're looking at. So what are some ways that we can avoid some of the muscle strains or issues that we run into besides acknowledging that we have pain? So like if I come to you and I tell you, hey Athena, I'm, you already know who I am, obviously, but if this was our initial consultation and I told you that I'm feeling pain in my back, and so we'll do a role play. All right, so bear along with us. Maybe this will make a little more sense. So hi Athena, I'm Justin. I'm coming in because my back hurts. And what would you say from there?
I would say, how long has this been happening? I'd say a lot of things probably you're not wanting me to say. Are you wanting to know, like, what are other factors involved in preventing injury?
Yeah. So again, I'm going to speak personally for myself. If I feel pain in my back and I have a busy schedule ahead of me, I'm most likely going to come home. I'm going to be grouchy because I'm hurting. I'm also going to be a little more stressed out because I'm worried that this pain is going to linger and I still have work to complete or responsibilities of getting jobs done as scheduled. So I'm probably going to try to grit through it and make things happen, even though I know I should probably be taking some time off. So what are some things that we can do that maybe we're not going to take time off, but still be able to get work done, and then take it slower when we do have a lax in schedule, or for us, wintertime hits and we can really recover and do the recovery stages of what's needed. But what are some things that we can continue to do that allows us to work, but also benefit us in treating our pain?
I gotcha. All right. So I have a few ideas. I don't really want to overwhelm this podcast. But some really important things to do is drink a lot of water. have great nutrition, like avoid sugars, because sugars cause inflammation, or they irritate the injury even more, and you'll increase your inflammation. There's also inflammatory type foods. So nutrition is really important. You might consider looking online at what might be inflammatory, and avoiding those things could be really a great way to improve your pain while you're recovering. Sleep also. Sleep is when our bodies are, one of the functions of sleep is it's a time for our bodies to recover and heal. So sleep is also essential. Stress management. Stress. If we had only learned this in health, how impacting of our, how stress impacts our physical health. It is very powerful. So if you can just, sometimes it's in our mind, so even if you're able to think something like, hey, Jesus has me. Jesus is walking with me. I'm not alone. Just like try to quiet your mind so you're not so anxious. Big win if you can do that too.
Awesome.
I also want to point you, if someone has especially an acute injury, one that they're treating, I want to point you in the direction of an acronym. It's not RICE anymore, folks. It's peace and love. And we're not going to go into that.
Is that like a hippie thing, or what? Peace and love. That reminds me of like the 60s, early 70s. But so
yeah.
RICE used to be the acronym for what? Rest, ice, compression, elevate.
Elevation. Yeah. Good job, baby.
Yeah, every once in a while, this big head of mine has a good thought or a good see, I can't even think of it. So back, I'm being my normal self again. So what is peace and love?
Well, like I said, I think we don't really want to get into all of that because it might overwhelm everybody. But okay, just peace. Peace is what is the new acronym. It's actually not so new. It's like 6 years old, but in the Midwest, things get to us a little slower. This came from, I think, originally Australia. Not sure, but P is of peace, and peace again, it helps us care for ourselves for the first 3 days after an injury. Okay, so P is protect, E is elevate, so that's so important. A, this is the new one, it's avoid anti-inflammatories. Like ibuprofen, Advil, Tylenol, all those medications. Avoid anti-inflammatories and avoid ice in the first 2 or 3 days if you can manage it, because what's happening in those first 2 or 3 days is that the blood is coming to that region. It's bringing nutrients. It's taking away waste products. And although it's inflammation, it can scare us a little bit and we don't want it around, it's actually proven to be very beneficial in those first 2 days. So C is compression, if you can, and E is educate. So like I have said, and I'm teaching Justin a lot about how our muscles work, healing times, and how pain works. A very important principle is that our brain is our protectometer. Its purpose is to protect us. So if you're ignoring your pain, then the brain will learn he's not listening. He or she is not listening.
Oh, I thought you were talking about me.
I'm going to send more pain. He's not listening. I'm going to send more pain. Because it's new. It's really new, and it's kind of nuts to think about. But our pain does not originate from wherever we're hurting. Now, where we're hurting is sending information to our brain, but our brain is interpreting. And our brain interprets and says more pain or less pain based on psychological things, our environment. If we're like in a dangerous place, our pain increases. If we're in a safe place, our pain decreases. And so it's really, really interesting. I love it. But that's peace. And look up love. Love is something that will be post-acute injury. So like after the first 3 days, then love takes place. And what's new about love is the O. I love it. It's optimism. Okay. L.
Let's not.
Okay. L is appropriately load. So even though you don't want to move, you start moving. Even if you might feel like you shouldn't lift, you don't lift something that's gonna cause you more than moderate pain, but you need to move and load in a mild or moderate pain area. Okay. And again, you're still listening to your body because you're not putting it in extreme pain. O is optimistic. So be optimistic about your recovery. Having a good, a good view of the future. Like I told Justin, this is a muscle strain. At the very most, it'll take 2 weeks for you to recover. Muscles recover super quick. And he's doing a great job because he went to work out today. And even though he's a little bit injured, he's still providing a lot of movement, which brings the blood. Again, we want the blood flow. So V, vascularization. We want that blood flow. So if you're injured in your shoulder, you can work your legs and your heart will start pumping harder to provide the blood flow to the legs. And just that heart pumping harder to that area will bring more blood to the injured area. That's what you want. So vascularization means if you're injured in your legs, then you need to be doing something with your arms, like boxing. I don't know. Like something that
Or brushing.
You're
doing a lot of brushing.
Yeah. Or just get that heart pumping in some way that's comfortable for you, that you can keep up for 20 or 30 minutes. At least a few times a week. Okay. E is, what is E? L is load, O is optimistic, V is vascularization, E is exercise. So this is what happens like after your first 3 to 5 days of acute injury. Peace and love.
So I wanted to bring it up because a lot of us are still caught up in that. I'm going to throw icy hot or any of the back pain, muscle pain creams, and then throw a compression brace or whatever on there. And then, that's going to help things. And so, yes, it took some time, but it's very educational because those are things that are now we're told not to do, right? So if my back is hurting, I'm not supposed to go put on a brace and squeeze it as hard as I can, and then put a bunch of put icy hot on me every hour, or take 4 ibuprofen every 2 hours. So yes, it's educational, and I think because I never heard of love and peace or peace and love until you brought it up. So now comes the really interesting topic, pelvic floor. Can you give us kind of an intro of what pelvic floor is?
Okay, so pelvic floor physical therapy is a therapy that helps with a lot of different things. It helps with sexual function. It helps with any type of incontinence. And it can, especially for women who are preparing for birth or recovering for birth, it helps them with that preparation and recovery. It can help with hernias as well. Like there's a lot of things that we go immediately to a doctor for regarding these things, and they provide a medication, and sometimes that medication provides a really quick result that we like. And but this way, that's kind of like a fast burn, right? Like a fast burn track. And physical therapy is more like the slow burn track. Like it takes slower, but you have it for a longer period of time. You have tools with you that you won't have to rely on the doctor and the medications.
Yeah, it's more of a natural healing process of your body, right? Instead of the pharmaceutical surgeries or invasive procedures where you're relying more on your natural healing. And
there's usually not a lot of negative side effects from this type of treatment.
Yeah. So how does pelvic floor affect males, or what's the positive treatment for a male who hears pelvic floor?
Okay. So one of the things that I have recently learned about is that it will help with erectile dysfunction. So if you think about how a muscle functions, right? A muscle, when we're exercising, let's just think about something as simple and as a bicep. You know, when we work this bicep, we're going to bring blood to this area, and the body just focuses on it when there's like a heavier load or more reps. And so, believe it or not, our bodies grow blood vessels, right? And our bodies grow nerve endings. So depending on what we do with our body, we can increase the blood flow to that region. We can increase the nerve endings to that region over time and with intent, right? And I've seen a lot of improvements and amazing things that people thought, oh, I just have to settle with this. This is just part of getting old. And no, it doesn't matter how old we are. Our bodies are still adaptive.
Yeah. And so when you think of erectile dysfunction, I was at the gym today, and every time it seemed like I looked up at one of the TV monitors, it was some drug for erectile dysfunction, whether it's Viagra, whether it's, I don't even know all the different names. Some of them are easy to say and some are not. But it seems like that's the answer to the problem, right? Take a bunch of pills. And then at the end of those commercials, it's always funny, right? It's always an older guy with a younger woman, and he can't get an erection anymore, so he's taking Viagra. And then at the very end of the commercial, where it shows, that they've had their happy ending, then you get the very quick auction-like voice telling you side effects may include diarrhea, vomiting, headaches, nausea, blindness, heart attacks, and it goes and it goes and it goes and it goes. But please consult your doctor before taking. And so with pelvic floor, for you men out there who are asking, why is he talking about pelvic floor? It's a way to exercise your pelvic area to allow, as Athena had mentioned, for that blood vessels to re-engage, grow, or not re-engage, but to grow, and then to get the blood flow back in there. Because a lot of times, as I am doing now, we're just sitting. We're in our trucks driving to estimates, we're sitting. And we're not strengthening our core, our pelvic area, our core. And that's why I kind of drew this picture, is a lot of us, we go to the gym and we desire the strong pecs. We want to have a strong chest, so we do a lot of bench pressing. We do a lot of biceps and triceps because we want to have big arms, right? We all want to look like the Popeye arms. And then for those who can, you saw my belly earlier. I do not have a six-pack, but we want that nice V-shaped upper body. And then a lot of us, including myself, my wife and I talked about this, that I do have big calves because when I was a snorkeler, I would swim miles and my legs were constantly being exercised and strengthened. But I don't do enough leg days. So a lot of us, those bigger upper body people, have these stick figure legs because we skip leg day or we don't even know what a leg day is. And why don't you touch a little bit on the importance of your legs?
So, a treatment for pelvic floor, what does that look like? Well, like Kegels are for women, whatever. But, you guys have pelvic floors too. And the cue for kind of contracting those muscles is nuts to guts. But that's not all a pelvic floor therapist does.
That sounds like a good shirt. Nuts to guts.
Nuts to guts. And it's actually all about the region. We strengthen the region. We give you the exercises in your hips, your inner thighs, your outer thighs, your quads, your lower back. It's a regional therapy. And because that's what we want. We want regional change. We want increased blood flow, more neurological input, right? We want all of that information going to our brain. We want more hormones that can reach the area or reach other areas. We just want to improve vitality, right? We're going to do that with strengthening. We're going to do that also with breathing. That's something that is also very connected to the pelvic floor that you don't really think about. But the diaphragm and the pelvic floor are they work parallel with each other. So when we take a deep breath, believe it or not, our diaphragm drops and the pelvic floor drops. And then when we exhale, the diaphragm retracts, the pelvic floor retracts. So as a pelvic floor therapist, we work a lot with breathing and coordinating breath. And I personally have been trying to teach my body to just do like a little pelvic floor contraction with inhalation, like especially when I'm running, I'm tired. I just start focusing on that little contraction and just helps me kind of distract from my legs. I'm just working on breathing.
Yeah, and breathing is super important. For years, I used the CPAP machine, which was a hassle for many different reasons. So if I'm traveling to go to military training or to go to a Stain and Seal University event, you have to carry your hose, your mask, and this little carry-on bag with your CPAP machine in it. And then you need to have filtered water or distilled water and all those different things. And then when you sleep, you've got this hose pushing air through your nostrils to help you breathe so you're not snoring. And the snoring's not the worst. It's the fact that you stop breathing. So you're not getting the oxygen to your brain. And so it was a huge hassle. And through some changes in diet, changes in exercise and breathing, I no longer use a CPAP. Now, I'm not saying don't use your CPAP and just, it's something you have to work into. But all these things, like as I'm sitting here and Athena was speaking, I was doing some Kegel exercise. Yes, male Justin, 52, almost 52 years old, is sitting there. But that's the neat thing about it is you could do it sitting on a chair. You can do it as you're driving. You can do it as you're standing. The hardest part for me, and maybe for some of you, is remembering to do it, right? So as she was talking about it, I'm like, oh yeah, I can do my little exercises, and it's strengthening those muscles. It doesn't require a dumbbell, doesn't require any fancy equipment, a membership to a gym, or to a community center, YMCA. It just requires you remembering and actually engaging and doing it.
And we teach our patients, we kind of talk to them for a long period of time, and we get an idea of what their day looks like. And we talk with them about where they can work these things in a functional way. Because our pelvic floor muscles aren't just to hold the pee. They're there for supporting every motion. So we talk to them about working them in so that they can support your entire region, low back, hips.
So we're going to try to wrap up here in the next couple of minutes. I guess my purpose of bringing you on was to make folks aware that there's an option out there that's less invasive, more, I always say natural, because we're relying on what we have, whether we're 140 pounds and 5'4", or you're 285 pounds and 6'4". Our bodies are very similar in the way that
they gave away our heights and weights.
Oh, my apologies for telling you my wife's weight and height. I don't care if you know how much I weigh or how tall I am or not how tall I am. But what I was trying to say is that regardless of the size of your body, God is amazing, right? So God is amazing for the fact that when you consider that he created a body that we have, and again, regardless if you're black, white, Asian, Portuguese, American, or whoever, that our bodies can heal themselves if given the proper education and knowledge. That doesn't require a bunch of surgeries. It doesn't require a bunch of medicines that potentially can cause other ailments. And
in some cases, I mean,
I'm not against vaccinations. Okay, I am not one of those anti-vax people. I'm not. Don't take any medicines.
We're just saying try something non-invasive before trying other things. If it doesn't work, it doesn't work.
And I guess in a long way, what I'm trying to say is, if you're anything like me, and you worry about if I have to go to the doctor's going to find that this and this and this is wrong, and I'm going to get laid up in the hospital, or I'm going to get laid up on being able to do or accomplish or complete work because my business relies on me, that there are other ways to educate yourself and taking care of your pains and aches that you can do at a very affordable cost to you, because most small business owners don't have any health insurance. That's the truth. Those who do have health, we have health insurance, and we're blessed for it through TRICARE. And so if we did have to go in for a medical emergency, it is something that we don't worry as much financially, because we know we're covered with very good health insurance. If you are up on a roof and you are self-employed and you are uninsured, and heavens forbid you fall off that roof, as many of us have done, it is a huge gamble. It could mean the end of your business, because there's no one else who's going to go up on the roof because you're a one-man or a one-woman team. Or you're now facing huge medical bills because you fell off the roof, you ruined your knees, you broke your back, you did whatever. So there's one of the benefits is preventative care, right? I see physical therapy as a preventative care measure, as well as when you do go in for those surgeries, or you have a birth, you give birth to a child, there's a preventative care procedure there or opportunity there to strengthen yourself, care for yourself without having invasive procedures to follow up in that potential preventative care. Mm-hmm. Does that make sense? Mm-hmm. So why don't you go ahead? I'm sorry.
Okay. Yeah. So I think you're leading up to me introducing my business. Is that right?
Yeah.
Okay.
Why don't you let us know what your business is called and how to get a hold of you if anybody has questions or wants to know more.
Sure. All right. So my business is called Tele-PT, and it's interesting model. It's cash based. However, if you have TRICARE or Blue Cross Blue Shield or other insurances, there you can get reimbursed. So you would pay me, and then you would submit the invoice to your insurance to get reimbursed. So I primarily, this is how I function in my business. We start with a phone call, and you talk to me about your primary complaint. I educate a little bit about pelvic floor, some of my successes, and talk to you a little bit about technology, how well you work with technology. And then it's an in-person initial evaluation. So I usually would come to someone's home. If that's not a good fit, then there's a clinic here in Plattsmouth that has said that they would lend me a room for evaluations. She's a certified nurse practitioner that I'm kind of partnering with. And then after the initial evaluation, and that is the phone call is free. The initial evaluation is $110. And then after the initial evaluation, I would treat online as long as you're a good fit for telehealth. So, and online means that you can meet anywhere. I could have a 15-minute, 30-minute, or 45-minute session with you, following up or instructing anywhere. So it could be on while you're on the job or at home or on vacation. It doesn't really matter. So, and
you do that like through Zoom or through
I have this
Messenger? Or
I have this really great software application that provides an secure online platform. So it's anything else I want to say. If you book online, book for the phone call first, and then the initial evaluation second, and the charges you pay at the time of the service. But I also want to say that I have a sliding scale. So depending on your income, my charges are modifiable. So I'm negotiable.
Most cash-based businesses run in that similar fashion. Some may have different applications, but yeah, if you're in Georgia and you're interested in doing something like that, obviously she could see you as far as with the consultation and things like that, but maybe you want somebody locally. And if you're you're looking for cash base, give your providers in your area a call. I'm blessed to have a physical therapist that I live with, I sleep with, and I can call upon when I have pains or aches. But a lot of the things in my previous experience with physical therapy seemed, for me, like a waste of time. And the reason I say it was a waste of time was those things I could do, they were things that I could do at home, right? Instead of driving to a clinic or a brick and mortar place and then having someone tell me, all right, put this band around your feet and do side steps down 25 feet and then back. And then they would run off, whether it was the physical therapist or their assistant would run off. They wouldn't run off, but they would go tell someone else, hey, this is what you're doing. So a lot of the exercise that I felt like that I was doing, I could have just done at home. And so I just kind of felt like it was a waste of my time going to a clinic, waiting for my turn, even though I had a 9 o'clock appointment. Sometimes it would be 9:30 by the time I was seen after checking in, doing all that. But what I like about the Tele-PT thing is that you're still receiving the care that you would at a clinic, but it's more on your time and more on your schedule. So time, schedule, and convenience of doing things. Now, not everything that physical therapists are going to do can be done through Tele-PT.
Like if you're struggling with pain, a manual therapy, like you're missing out on the manual therapy, and that's a really big deal. So I'm not a good fit for pelvic pain. You know,
Mm.
even if a woman who is pregnant is having pain, I'm not a good fit for her because I'm not going to be in person massaging those areas, and she needs that. So that's when the brick and mortar physical therapists really they
Yep.
do great work there. So, and I probably will eventually get back to that, but right now, my lifestyle, I want to be available for my kids. So my hours are usually 8 to noon, Monday, Wednesday, Friday, and they get off. We're just doing partial homeschool. So they get home at 1, and that's when I'm off work. So,
Yeah. And I may become a massage therapist.
ooh,
I'm putting these hands to different repetitions instead of brushing. I'll just start chopping.
you'd be a good massage therapist, honey.
All right. Well, let's leave on that note before we get too much into either that, or I even thought about becoming a sexologist, just a different career that I heard about. I had no idea that you can be a specialist in.
Or sex therapist.
Yes, I think maybe that's what it is.
You would be a good sex therapist.
Yep, talking about
Like with
intimacy and the importance of touches and different love languages. I would probably get messed up with all the scientific verbiage, and I would probably have to rely on my slang for,
As long as you can
what is it?
get a C. C's
Yeah.
get degrees. Pass that off. Pass the course
Yeah.
and get there, baby.
I was, I think, a C minus, maybe a D in high school, and thank goodness I made it to college. And then in college, I actually applied myself, probably because when you pay for things, it means more. And when education is free, you kind of take it for granted.
Mm-hmm.
So all you socialists out there who believe everything should be for free.
And he was on the dean's list when he was in college.
Yeah. Well, folks, thank you for joining. I hope this was informative, helpful. If you're a male like myself, I'm not a young chicken anymore. I'm more of a mature rooster. I'll share a little bit of the inside of Justin. All right. So I use physical therapy for sexual purposes. And what I mean by that is strengthening my Kegels so that I have a little better blood flow down to the penis or to your dick or to however you want to.
Don't call it the slang names.
Again, see, that's why my sex therapy thing might not run very well. Can you imagine? I'm sitting there in front of the professor and I'm like, yeah, you take your dick. No. You mean your penis. Sorry, your penis.
Anyway, go ahead.
Anyways, it helps the blood flow. I am at the point of my life where if I don't have to take a pill for anything, I would be extremely happy. That's my goal in life for me personally. And so as I get older, I start thinking, well, maybe do I have erectile dysfunction? No. How do I prolong ejaculations? Another thing physical therapy can help you with without medicines and evasive things.
Not prolonged ejaculations. You prolonged the leading up to the ejaculation.
Yeah.
So you're lasting longer before an ejaculation occurs.
How many of us husbands or males out there do not want to have a long love-making, love-sharing moment and get rid of those 2 to 3 minute tales or stories that we hear that most average American male lasts 2 to 3 minutes in intercourse? How many of us would not want to be 5 to 7 minutes, 10 to 12 minutes, whatever? And again, with your companion, that should be based on a mutual respect and understanding. Because if you're
But
laughing,
you can share your story. You could tell them about the spray. You want to tell them about the spray?
we'll leave that for another intimate episode. Maybe I'll go on Mark Olson's podcast
It's not
and talk about.
bad. It's not that personal.
No, so there are pills for erectile dysfunction. There are sprays that you spray onto your penis. I'm using the right language to desensitize you to the friction of intercourse, right? The in and out. And so it prolongs the feeling, so it numbs your ability to feel the action that takes place with intercourse that you can spray. And I did that because I wanted to be the guy who lasted in bed as long as I could to satisfy my wife because that's a desire and goal that I have. And I've been able to prolong having to use that by breathing, practicing Kegels, and doing natural things that help with extending my time in our
You don't
bedroom.
have to use the spray anymore. Is
Yeah.
what he's saying. Yeah. He doesn't have to.
One less spray.
He had three. He wanted to pay me as a pelvic floor physical therapist. I was like, no, we're not paying taxes on both of these.
I didn't think that one out. Right?
I was like,
Uncle
no.
Sam, always looking to take back as much
It's like,
as he
can I hire you? And it was very sweet. But seriously, he's such a quick learner. I think we had an initial evaluation and 2 treatment sessions.
Yep. And here I am doing my
And no spray.
exercises
He
as
doesn't
we
have
were talking.
He doesn't have to use a spray.
Yeah. So, men, males, queens, ladies, wives, partners, whatever your relationship status is, there are many things out there that are available to all of us to help us in not hurting ourselves and continue to hurt ourselves, to improve our natural health and our abilities to recover from injuries, and to do things that are preventative so that we're not getting hurt. We're going to wrap things up. We're coming up on 60 minutes, and we just wanted to say thank you for tuning in and watching, listening, however you're listening to this. I will put a link to Tele-PT on here if you're interested in finding out more. But until next time, have a wonderful day.
Bye.